And well, a Sacramento surgeon is revolutionizing knee replacement surgery. It's a new technique that's promising better results and faster recovery for the patient. My up-close report just ahead. Your knee is the largest joint in your body, and when it wears out from severe injury or arthritis, it may be time for a replacement. More than 500,000 are performed each year in the U.S. And while a lot of improvements have been made since the first knee replacement 40 years ago, the basic technique the surgeon uses to fit the implant hasn't really changed. Well, now two PhD engineers from UC Berkeley and UC Davis have teamed up with a Sacramento orthopedic surgeon to develop this. It is a way to custom fit each patient. And in my up-close report tonight, we take you inside the operating room to show you how it works. And just a warning, it is major surgery, so it's a little graphic. Ooh, you can feel it popping, huh?
Oh, yeah, and it's good today.
Like a growing number of baby boomers, Kurt Duncan's sports injuries and active life have taken a toll on his knee.
I am in pain constantly. I mean, it is like 24 hours a day. You can't sleep. You can't do the things you want to do.
This is Kurt's knee, and you can see this gray right here, and here's normal cartilage. You don't see any there. Bone on bone.
Now at age 52, he's facing total knee replacement.
I've been through knee surgeries before. Not quite this drastic. They're going to take a piece of my body out. That's scary. But I think we'll be okay.
We have Kurt Duncan. We're doing a right total knee replacement. Dr. Howe.
Kurt is more confident because of a new technique to custom fit his new knee.
We're going to make a minimally invasive surgical incision just medial to the midline to avoid pain when the patient kneels. We put this in.
It's called the Otis knee, and Dr. Stephen Howell of Sacramento's Methodist Hospital is the first orthopedic surgeon in the country to use it.
Each patient is unique, their anatomy is unique, and if we put the parts in that way, then the recovery becomes very simple. Pretty good.
Here's how it works. Before surgery, an MRI takes precise measurements of the patient's knee. Using 3D image software, the bad knee is virtually restored to its original state. Then a 3D image of the implant is matched to that knee model to determine the correct size and placement of the implant. Finally, all the information is used to create precise cutting guides for the surgery.
Well, this is the Otis knee guide, and between this guide and the second guide we're going to use, we can make all the decisions about where the implant has to be placed. Posterior medial is 8.
Dr. Howe says the custom fit means less time in the operating room.
Good.
And more streamlined surgery.
The thing you might notice is the trays here. That's a very simple setup with the Otis knee. There's hardly any instruments on the tray, on the tables. If we did a traditional knee, there'd be 7 trays, there'd be 2 big tables, more chance for something to get missing, something to get infected, get contaminated. Good.
And by preserving more of the patient's bone and ligaments,
perfect.
A much easier recovery.
These patients theoretically could just get up and walk home today on their new knee if they weren't a little tired and a little sore from the operation.
The proof is really in the patient's quality of life and how quickly they can get back to doing the things they love without pain, like swinging the golf club.
It's not the easiest thing in the world to do,
Lee Grishon had a custom knee replacement in late February.
Well, he says, we'll have you out hitting the golf ball within a month. And sure enough, it was a month to the day.
He's since played over 20 rounds and is pleased with his progress.
You can almost not even see the scar right now. It's almost gone, so it's just going to take some time. I do have a little swelling, and I do have some lack of flexibility there, but I fully believe over time with my exercises and therapy, I'm going to be fine. I'm going to be 100%.
Outpatient as well. That's right.
Meanwhile, Kurt is hoping to rehab quickly after his surgery.
We can simply flex the knee.
And with a new custom-fit knee, enjoy the rest of his life pain-free.
I think he said I couldn't run the Boston Marathon or I couldn't climb Mount Shasta. But you know what? I still may try to climb Mount Shasta.
And he probably will. Well, the Otis knee technique is now being used at several surgery centers around the country. 500 have now been performed. Dr. Howell has done about 150. If you'd like more information, you can contact Methodist Hospital at this toll-free number on your screen. And we also have a link to their website on news10.net. And Dana and Darla, I talked with Kurt tonight. He had a surgery on Tuesday. He went home on Thursday. He says he's still feeling some pain and discomfort from the surgery, but he said his knee feels so much better than it did before the surgery. And he also said he got up and walked. He's been walking. He's walked a very long driveway. It's about 100 yards, and he did that 3 times today using crutches. But that's so much faster than traditional ways of knee replacement now.
I know he said you can't run the Boston Marathon, but can you run?
Actually, after knee replacement, they say you probably shouldn't run after knee replacement, but you can do a lot of other things like playing golf and just get rid of that pain.
Well, it's better than being in pain, that's for sure.
Yeah. But anyway, all developed right here by a Sacramento surgeon.
Pretty
so
cool.
Yeah, it's pretty cool. That's simple, but really helps people. Well, tonight I have a story for all of you who have experienced chronic and severe knee pain. A Sacramento surgeon has developed a new technique to custom fit a total knee replacement. It uses these special cutting guides. Now, you might remember we followed a local man's surgery about 2 months ago. In my up-close report tonight, we check back in with Kurt Duncan to see if the custom fit delivered on its promise of a faster recovery.
How's that feeling?
Good.
Kurt Duncan says life is much better now since his total knee replacement.
I'm able to walk upstairs normal. I'm able to walk downstairs normal. I'm able to play golf. I'm able to get on my hands and knees with my granddaughter.
He credits the custom fit for his quick recovery.
I think I'm probably about, I'd say 85–90% back to normal. I'm able to ride a bicycle now. I could never do that before.
That'll work just fine.
It was just about 2 months ago. We followed Kurt's surgery at Sacramento's Methodist Hospital,
Straight.
where Dr. Stephen Howell pioneered the new custom fit technique called the Otis knee.
Each patient is unique, that their anatomy is unique, and if we put the parts in that way, then the recovery becomes very simple.
Before surgery, Dr. Howell takes a precise measurement of the patient's knee. Using 3D image software, the bad knee is virtually restored to its original state. Then a 3D image of the implant is matched to that knee model for size and placement of the implant. Finally, all the information is used to create precise cutting guides for the surgeon,
Let's pin it here.
leading to less time in the operating room and preserving more of the patient's bone and ligaments.
I can see how much progress I've made.
Kurt was out of the hospital in 2 days and walking without crutches or a cane within a week.
Once I had the confidence built up that this was actually fixed and I could do things,
It's not just the surgical technique, but the rehab that's very important in recovery, and Kurt is highly motivated.
His motion is good. I know his
Physical
motion goes
therapist
beyond
Christy
what
Hunt
he
says she sees a difference in patients with the custom fit.
The recovery is a lot faster. It seems to have less pain. The swelling isn't quite as bad, and the motion comes back quite a bit faster.
If we look at that extension of the knee, it's right at 0. And how far can you bend it up? Good. Take as far back as you can. All right, and you're a little swollen because you played golf twice, huh?
Close to 1,000 of the custom fit knee surgeries have now been performed nationwide as more and more doctors adopt this technique.
It's not that we're better surgeons, that we're enabled to be better surgeons because I think of the instrumentation with the custom fit concept.
And for patients like Kurt,
you can barely see it down here.
it's a welcome relief to finally be pain-free. Any regrets or second thoughts or anything?
Absolutely none. I mean, absolutely. This was probably the best thing I've done this year, so.
Well, Dr. Howell recently returned from an East Coast swing through Harvard, Wellesley, and Boston, and in Philadelphia, meeting with doctors who are now using or about to use this custom fit technique. I also talked with some other local leading orthopedic surgeons who are intrigued by the idea, and they are watching the results. Now, if you'd like to learn more about it, just go to our website, news10.net, and click on the links. And you can also see my original story with Kurt Duncan in the up-close reports section.
Now, you have here, now, is this a knee? Is this what it looks like?
No, these are the custom cutting guides. It's the same. It's a knee replacement. That's not different. It's the way you cut the guides and put it in and place it for each patient's unique anatomy. So these are guides for the surgeon to actually know where to place the implant.
Okay,
so
very good
that's
then.
what
It has
is,
a long life expectancy. Once it's in, it's there.
Yeah, it should last your lifetime.
Excellent. All right,
Hopefully.
that is exciting.